Well, this is my first conference with FPA. Excited to get to talk to some of our representatives about what's important to us and our patients.
Well, this is my first time at Advocacy Day.
I'm excited because this is my first lobby visit with Planned Parenthood.
We're happy to be here today because my daughter is active in Planned Parenthood and got us involved in this, but 30 years ago I was here as a young woman lobbying.
I got involved in Planned Parenthood partially because my mom had experience there and had, was a big part of, I guess, growing up in like a pro-choice household.
Family Planning Advocates is viewed as one of the most credible entities and advocacy organizations that we have in our great state. Thank you, first-timers, for coming to Albany. Your voice is particularly important to be heard. When we talk about reproductive rights for women in our state, we're talking about a very, very key public health concern.
Family planning advocates have been those whose advocacy has made New York a better place to be with practical service and passionate advocacy. In my State of the State address, I suggested that we need to get politics out of the budgeting process, out of ethics reform, and certainly out of our economic development plan. But if there's one place we definitely need to have politics out of, is a woman's right to choose. So I recommit myself to passing Women's Reproductive Health and Reproductive Rights Act, which is our program bill, which we want to pass as soon as possible because of the protections that we need to add at this time when there seems to be a new movement to eliminate protections that we've already provided.
If ever there was a year when we needed you, this is it. We experience firsthand every single day the good work that you do.
Thank you for the work that you do, and thank you for being here today.
Just so you know, I'm steadfast and I will be fighting as hard as I can for women's right to choose and women's right to reproductive health care.
I'm the only nurse in the New York State Assembly, and I've worked in healthcare for close to 30 years. And one of my first jobs out of nursing school was a holistic clinic in Santa Barbara, California. And we ran a women's clinic. And I had come from a very Catholic school background. And my experience at this clinic made me the woman that I am today. I know how important it is for people to have choice, for us to defend choice.
Your health rights are my priorities.
That I think that the right to choose should be left to the woman, her doctor, and her God, and nobody should interfere with that.
I am so glad to see so many women in Albany. I am so glad to see so many men and women here fighting for the rights of every family in the state of New York.
If your real interest is in preventing abortion, if you really want to see less abortion in this state, in this country, in this world, as many people of good faith do, you should be supporting family planning advocates. There are a few issues in which the human rights and the kind of financial realpolitik dovetail so precisely. There are a few issues in which doing the right thing morally makes so much sense economically, and that's something we see with reproductive rights.